Hi, everybody. This is Marie, and I have Sandra with me here in the office, and we're really glad that you all could join and this discussion about families participating in decision-making. And I know from looking at the list of people who are on the call that we're going to have a really good discussion, lots of people with lots of experiences. So I'm going to, okay. I want to just start with the National Federation's vision through a family and youth-driven approach. Children and youth with emotional, behavioral, and mental health challenges and their families obtain needed supports and services so that children can grow up healthy and able to maximize their potential. Very fine vision. And we have the mission of the National Federation. I'm not going to read through that just now. And the goals for today, we have two goals, to share practical examples of what working toward being family-driven looks like, and to share examples of family members participating in decision-making. So we want to start with some introductions and who is participating. And the way that I thought maybe we could do this is if we start with roles, and then you can introduce yourself by saying what your community, state, or tribe is, your name, and then your community, state, or tribe. So we'll start with project directors. Do we have any project directors on the call today? Okay. Do we have any lead family contacts?
Yes, this is Libby Jones. I'm the Family Support Director for North Carolina Families United here in North Carolina, and I'm the lead family contact for the System of Care grant that we have.
Thanks, Libby.
This is Kay Barkin. I'm with Hand in Hand in Fort Worth, and I'm the family lead for our System of Care grant.
Hi, Kay.
Hi.
This is Jerry
Hi,
Mullendor.
Kay.
Go ahead, Jerry.
Go ahead, Jerry.
Sorry, guys. This is Jerry Mullendor, lead family contact with the Oklahoma Department of Mental Health, Systems of Care, Oklahoma.
Great. Thanks, Jerry.
This is Candace Ayler. I'm the parent representative for the Texas System of Care Consortium
Welcome, Candace.
for the statewide System of Care grant.
Great. Okay. Any other lead family contacts? Okay. Do we have any youth engagement specialists? Okay. Any executive directors of family organizations?
This is Sherry Dowling. I'm with the American Society for Deaf Children as the Advocacy Director.
Welcome.
And this is Trish Thomas with National Family Voices. I'm the Director of Outreach and Diversity.
Welcome, Trish. Okay, so we have some people who haven't yet introduced themselves, and maybe I'm just not thinking of what their role might be. So if you haven't already introduced yourself, would you do that now?
Hi.
Stephanie. I'm Stephanie Hoffman with Idaho Department of Health and Welfare, program specialist, and we contract out to our Idaho Federation of Families for Children's Mental Health for this service.
Welcome, Stephanie.
Thank you.
Someone else?
Hi, Marie. It's Barbara Haff, and
Hi, Barbara.
I work for the National Federation of Children's Mental Health on a contract that we have with that's kind of a partnership with Vanguard Communications and the National Association of State Mental Health Program Directors, and I work on the social marketing campaign team, and I provide family voice to the campaign team, along with providing technical assistance to about 23 states and communities, territories, and tribes.
Always good to have you, Barbara.
Thanks, Marie.
Okay, I see Marianne Mason has typed in her information. She's from the Louisiana, and she's the Director of Family Involvement at Magellan Health. Is there anyone else who would like to introduce themselves? Okay, let's go on. I have a slide here with the definition, just in case there was any confusion about what it was we're talking about. That family-driven means families have a primary decision-making role, and we're mostly today focusing on the policies and procedures governing the care for all children, and that means decision-making about culturally and linguistically competent support services and providers, setting goals, designing, implementing, and evaluating programs, monitoring outcomes, and partnering in funding decisions. So I hope we can at least touch on some of those. Okay. Sandra?
So we want to make sure that we frame this as a discussion. So this is all of the presenting that we're going to do as the National Federation team. We want to really engage in conversation because the learning exchanges are supposed to be peer learning. And so we know that the work is being done in the field by you guys. We know that we can have a great opportunity to learn from each other what's going on. But let me just frame a little bit about why we are doing some of these learning exchanges. You know, for the past 25 or so years, the family movement has grown, and families have engaged and been involved in multiple things and systems of care. And but we have been seeing just different roles and different things. And so what we're hearing from families across the country now is that sometimes systems seem to be getting comfortable. People are not focusing so much on family-driven care, family-driven practices. And so we want to make sure that we continue to have the conversation to see where families are really being involved in good decision-making so that they're shaping, changing, and evaluating the systems that serve their children. So on the screen right now, you just see just a couple of questions that we're going to open for discussion. So the first one is kind of around family-run organizations, because we know that a lot of you do your work in conjunction with family organizations. So how do family members contribute to those family organizations? Do family organizations make sure that they have a lot of family voice? And is there families that's in the field that help shape the policies and procedures around what the family organization does? Is there anyone who can speak to that?
I know we had a couple executive directors there. How do family members contribute to your family organization's decisions?
This is Sherry Dowling with AFDC, and for us, we have on our board, we make sure more than 50% is families. If we have something that we're talking about, we make sure that families are involved in the discussion with any changes that we want to make, different things like that.
Thanks. And the reason we started this with family-run organizations is sometimes as we go around and we talk to people about making sure that they're implementing family-driven care and having family voice, they really ask us about family-run organizations, and do family-run organizations really engage and listen to families as well? Is there anyone else who wants to share of your experience with a family-run organization?
Sandra, this is Libby Jones in North Carolina, and our statewide family organization is made up of all family members. And our board, I think, at this point is all family members as well. But we also talk to families that we work with that are in the community and the families that we're supporting and helping and getting ideas and information from them. So, our families are involved in the work that we do.
That's great. That's a good example because I don't know if of many organizations who have all family members as employees and on the board. That's a great example. So you really are family driven with your family organization.
100%.
Great.
Yeah, and this is Trish Thomas with the National Family Voices. And we do have 60% of our board members are family members, and we are a national organization and support the family-to-family health information centers, and a lot, again, family-run, family-driven. We also look at being inclusive of youth as well as families of diversity. We could be families in rural areas or racial and ethnic populations, and looking at the importance of including those populations because cultural differences and linguistic differences really impact that family involvement. So we make sure that we are including holistically the populations of families in the country.
Wonderful. So do you all have those kind of things written in your bylaws and your policies and procedures?
Yes.
Wonderful. Great example.
I have a question. This is Stephanie Hoffman, and how do you ensure that the folks on the board, advisory board, once they've been there for a long time, and now their children are adults, like many years into adulthood, how do you go about getting some fresh parents on the board so that things are more relevant to today's system of care?
Excellent question. It really is. We hear it a lot. Is there some folks on the phone who can start to answer that question?
Well, this is Trish again. We really look at staggering our board membership so that, new family members we seek them out as well as youth, and we make sure that there is, at least two who have been on the board and can bring the new folks up to date on what's happening, because sometimes what happens is that we're very enthusiastic about bringing the new folks on, but a lot of them, again, don't come with the history of what's already been done. So, we found that it's very important to have those, again, seasoned, I'll say, board members on to really help them in the transition of overall into, what's been done with the organization, and always looking again for, we try and, I do a lot of mentoring with families of diversity across the board to get them to sit on, various levels at the state, community, finding out where they're most comfortable, at an early on.
Right. How about anyone else? I know that with some of the system of care communities that deal with special population folks acting on
That's 505-872-2776. Okay, it stopped.
Thanks. So we do hear this a lot. So if your system of care has a special population, like if it's early childhood or middle-aged students or transition age young people, I think is to really talk to the system of care people to see who they're serving and make sure that the people that are being served are also represented, within the organization and within the governance. Anyone else want to try to answer that question?
I actually have a question about the question. Are we still
Okay.
talking just about our family orgs?
Yeah,
Yes.
Okay.
in
Okay.
family organizations.
Okay.
And one of the things that we talk about kind of a lot is that a lot of the family organizations, if I look through the federation chapters, for example, a lot of the executive directors and staff of family-run organizations are parents of adult children. And I think you're right on about that, but I think one of the things is that that's when you probably have more time to devote to something like this. It was very hard for me when I started to do this work full-time to have school-age children that were really continuing to constantly be in need of services and in crises. But I do think that as a national movement, we really do need to do a lot more around bringing up young families, young parents, and those who have their children currently receiving services to even be employed and consult with family-run organizations. So I think that's a really good question and probably something we really need to look more into, because I am hearing a lot about that. There are a lot of administrative folks are saying that everyone that's working with certain family groups all have adult children and don't have relevant experience. But I think we have to keep all of them. We have to keep parents who've gone through it and have them to mentor. I think like Trish was saying, have them to make sure that they bring on and mentor other families.
And Sandra, this is Libby Jones again. And some of us are parents of adult children, but those adult children have kids, so we have grandkids who are going through it. So we still are kind of relevant to that. But within our organization, we have term limits for the board, so they're only on for so long. But when it's time to find new members for the board, we look to see the family partners that we have. Do they have families that they think would want to sit on the board, and look to recruit family members from them? But we start early on by really working with the families and putting them on committees that we have, not just family organization committees, but committees within our system of care around the state. And we train them how to sit on the boards and committees, and we train them how to work with other organizations and agencies. And then once they get that experience, some of them want to go on and do more, some of them don't. And like you say, when they have young children, sitting on a committee or on a board, it's not something they want to do. But once their crisis is over and they're stable and things are better, some are willing to go on and want to do more. And we do have that policy in our policies and procedures for our organization. We've got it listed, how do we do it, what our goal is, and so yeah, we do have that.
And
Wonderful.
This is Jerry from Oklahoma, and I can tell you that one of our family organizations really takes a very focused effort to get out into the communities and talk with all of the families that are interested to, say, attend a focus group. Not all families are at a place to where they can fully participate as a board member or as even a community member that attends the meeting all the time, but it doesn't mean that their voice isn't important. So because of that, our family network goes to the different communities within our region, and whenever decisions is something that we're looking at the state level, or they're even looking at their own level, then they're out asking. They've got a finger on the pulse of what people are saying, and they make a real wonderful effort to be out there. And that's the only way you can, is if you're out there, because you have families that may not ever want to serve on a committee, but they still have vital, very valuable information and that can help us as we're trying to be change agents.
Hi, this is Norm LeBlanc from Maine. I'm kind of a latecomer. I got hung up and I'm now part of the group. And we basically use the same model of family-run and family-driven. And within that model, we have what's called a targeted parenting assistance, which is based on 10 levels. And we also offer a family empowerment training. We don't never send anyone out into system of care or state meetings or committees without that training, so they're not left alone. And we also offer support if they need it after the meeting.
Oh, wonderful, wonderful. You know, some of you guys who are saying that you have policies and procedures in your bylaws and things, we will ask you to email them to Marie and I after the call, because I think we could set up a way to share some of that for those organizations who maybe have not yet figured out how to write some of this stuff in their policies and procedures. That's an excellent example. Thank you for sharing. So let's move on a little bit, and you'll see on your screen now that we want to talk about how families are involved in decision-making within systems of care. And even within the system of care, are there policies and procedures that you guys know of that really help ensure family voice and family participation in really good decision-making? So what about on the system of care level? And I'm hoping that there's a lot going on within that, because it certainly is mandated in the grant applications that families are involved that way.
This is Jerry again, and of course at our state advisory team, we have, there's usually over 30 members, and of those members, a significant amount are family members and their designees, and it doesn't matter whether you're a family member or designee. If you come to the state advisory team, you're at the table. Your voice is heard. You get to vote. Your vote gets counted. Yeah.
Wonderful. So is that written anywhere?
Yes,
Mary?
it is in our, I'm certain that it's in our bylaws and membership.
In Maine, we participate with the System of Care grant. There's only one agency that does that, and it's not statewide. It's kind of regional, and they started in one region, now they're in another. But we partner with them for different projects that are going on.
Wonderful. So how, for the rest of you, how are families involved in decision-making in systems of care? I know most systems of care have to have governing structures and advisory councils and people who kind of oversee the system of care implementation and planning. So how are families involved in that decision process?
Hi, this is Mary Ann from Louisiana. We do, as you mentioned, you know, there is an existing forum structure for parents and families to be a part of, overseeing what is going on. And at one example of how those families have influenced in Louisiana is that when we were having some difficulty, our family support organization was having difficulty, there was a special work group that was formulated to support the family support organization, you know, like do some footwork and have some discussions and connect them with some other entities that could help them to be, you know, there were some financial things, there were some educational things. It was definitely a new program for that statewide organization. We still do have the Federation of Families, which is awesome. This happens to be a specialized group where they are part of a coordinated system of care, family support, Medicaid-funded services. So, but they did, I mean, I myself I had talked a little bit and some other parents, but because they were part of that structure, they were able to impact, you know, in a timely manner. So that's just one example.
Great. What about others?
Sandra, this is Libby again in North Carolina, and within our local system of care grant, we have family members on all of the different committees, and even within our project team, if we don't have a family member there, then you can't have the meeting or you can't vote on anything, which I think is pretty good, that we've got that family voice there. And on a statewide level, we have the System of Care Collaborative, and it is not a mental health collaborative. We've made sure that it's a collaborative for all agencies around children, from child welfare to juvenile justice to mental health and everything. But we have, instead of having chair and vice chair, we have co-chairs, and one of the co-chairs always has to be a family member, which I think is, and all of the subcommittees also have to have a family member as a co-chair. And right now we've got quite a few family members attending our state collaborative, which hadn't happened in the past, so we're really excited to see that happening.
This is Stephanie again, and I have another question. And everyone, when we talk about family members, I do know what that means, but sometimes I go to committees or coalitions and the family member, the people that are there are agency reps as well as the family member. And for myself, I don't really call that a family member. I'd like to see more family members that are not part of an agency. Does anyone else have that type of situation?
What about the rest of you guys? Have you guys noticed that in some of your committee and agency meetings?
This is Kay in Fort Worth. In fact, we have kind of the opposite problem. The stigma remains so high that although there are a lot of providers who have children with mental health issues, they will not identify themselves. And honestly, I think they are just as capable of being family members as someone who's not working within the system, and in fact could have more impact just because they're inside the system already.
Well, I certainly, yeah, I agree. They are definitely capable, but what happens sometimes is they're, because they wear two hats, sometimes that agency philosophy gets in the way.
You know, it might. In fact, I had someone once tell me that since I worked for the agency, I would choose it over my daughter. And I really did not like being told that because it's not true. I think that there is many valid concerns and issues that people, I wish we could involve more people and make it a safe place for the people who work within our mental health care system to come forward and not lose status, prestige, possibilities for promotion, because that is what happens.
That's unfortunate.
So, it is. So to understand your question a little bit better, I think it was Stephanie.
Yes.
Okay, so I just remember an experience when I was on a state collaborative back when I was in North Carolina and doing this work. There would be families that would go who just sat in that role as family members, and then there would also be agency folks who, for the years of working, you didn't know they were a family member, but right at the opportune time, if we were going to not be able to have a meeting because there were no families there, they would say, well, I'm a family because, blah, blah, blah. And that was the only time I remember then there was a conflict because they had not in the past worn that, quote, family member hat. But I think that, we have to make sure that we are, balanced and valuing. So I think of some agency folks right from the bat, do step out. And I know that there is risk for everyone when we step out and say that, we are raising children with mental health issues. But I think people have to be clear when they're at meetings what hat they're wearing, what perspective they're representing, because I've seen professionals get in trouble at meetings when they were supposed to be wearing their professional hat, and they did what the agencies thought was too much advocacy for families.
Mhm.
So I don't know if anyone else has had some of those experiences, because it's really difficult when you're representing a collaborative to have to wear more than one hat at a meeting and be able to really do the advocacy kind of thing.
Mhm.
And Sandra, when we do trainings, there's a training here that we do. It's called a Child and Family Teams, and we have a team that teaches that does this training. It's an agency person and a family member. We saw some agencies in the beginning try to have some of their people claim that they were a family member, and our state collaborative, which is the one that oversees a lot of this, has stated and made the people say, you can either be a family member or an agency, but you can't go back and forth between the two. So it's really been good, because it's made people really look at, what role am I playing when I'm in this training? And it's really beneficial for the participants to see it that way. But it's been some interesting discussion along the way. But in the end, it has been that people have all said, you're one or the other, but you can't stand up and be both, because it does make it difficult.
Wow.
I have a comment about that.
Go ahead.
In Maine, we make sure that in gear that we, because we are parents of children with behavioral health needs, we can speak for our families because we also have the contact with our families. So it's parent-to-parent contact. And we are asked very often to send a family to like a wraparound collaborative. And the issue that we have had is the collaborative does not want to pay families to participate as far as their reimbursing their travel and their time. And therefore, families would rather not participate.
Right. Wow. Yeah. It's interesting. I know that a lot of you guys on the phone have already climbed that mountain around how we validate and compensate families. So can anyone speak to that? Some of you other guys, I know that you all have done a lot of work around making sure that you have families at meetings and that they're compensated.
It's a fight to get that, and most agencies say we don't have the money.
Yeah, and I think one example I do know of, and maybe I know some family organizations can speak to it, but a lot of times agencies can contract with the family-run organizations and give them a certain amount of flexible funds so that they can be the ones that help families with transportation and stipends and those kind of things. Because sometimes because of agency bureaucracy, it's really difficult for them to give out that type of funds, because sometimes they're, very small amounts for maybe a day of training or, gas or child care. But there are many different ways, and I'm sure we can find some documentation maybe that could help you give them some ways to do that. Sometimes it's not just about money, but it's about how to do the processes of making sure that you can quickly and easily compensate parents. But I think compensating them is also validating their participation.
Yes.
If you really want families...
And for many families in Maine, they do not have the income to participate. They would love to, but,
exactly.
Poverty is an issue.
And that should not be a barrier.
Yeah.
So real quickly, I wanted to maybe try to close out from the first question around, whether people can, wear professional or family hats. And Stephanie, did you get enough answer to that question?
Oh, yes.
Okay.
Definitely.
Yeah, and I think we got some good feedback on that. And
right.
so the question about compensation, I think it's a no-brainer. I think if everyone else who's involved in that system of care, making decisions around that table, is there on a salary or some type of income, then it behooves everyone to figure out then how to do the same for those families, especially if you really want the authentic voice of those families who are being served that may not necessarily work within a family organization or something like that. So, if you, they can get some statements like that from the Federation, maybe that would help convince the agencies. But I think that if you really value family voice, I think that there should be some way to support and compensate them. Does anybody else have a comment about that? Do you guys agree with that?
Absolutely.
Yes, absolutely.
Yep, I agree.
Yeah. I just think that we're still grappling with that issue of how to make it happen. And, we have money for everything that we need money for within agencies. And so I definitely think we can figure out how to compensate families. Does anyone have any examples of when families participated in a decision-making process that really influenced the direction that the system of care was going in? So think about all of your meetings you've had, your collaboratives, your governing structures, where families have brought something to the table.
My to-do list is on this phone. Is this a good time?
Excuse me?
Let me do this. Let me hang up on this call. I'm listening to how you get families involved at all levels of decision-making.
Somebody needs to mute. We hear you having your outside conversation.
Let me hang up on that, and then I'll call you back on my landline so I can see my to-do list with you. Thanks. Bye.
All right, so I'm going to continue. So, and I'm going to start off with giving a quick example where this really, and this was years ago, but it was also one of the first systems of care grants that North Carolina received called Pen Pal. And we were at the Community Collaborative, and we were trying to, talk about the next year and what we wanted to offer as services to families. And so some of the family leaders came and brought the concern from the families. And the concern was that a lot of children being served in our system of care were having a hard time getting into summer programs when school was out and staying in their after-school programs, and they didn't need to be latchkey where they came home to empty houses until their parents came home from work. And so the families asked the system of care if they could figure out a way to support children who had to go to after-school programs like the Boys and Girls Clubs, the YMCAs, the parks and recreation centers in the community, because these kids were oftentimes getting kicked out of those programs because of, there were a lot of children there and there was no structure. And then when school was out, these kids still couldn't get into those all-day summer programs at places like Boys and Girls Club. So we took that concern to the Community Collaborative group, and they really did sit down with all of the agencies, and we had university involvement as well, and we came up with a program where we could put students and case managers and different people within some of these agencies to help children who have behavioral health problems sustain within those agencies that were so unstructured that these children had a hard time. And we even created a summer program in collaboration with the school system so that these children could be a part of some of the summer day programs while school was out. And they actually found the funding within what was allowed in the system of care because they were able to do some group therapy. Families could come in the afternoon and do some of their child and family meetings right at the facility. So anyway, they overcame the barriers of how we're going to pay for this, who's going to do it, because it was a need that the families had. They brought that need to the collaborative. It was a part of the decisions that needed to be made, And I think the whole process ended up being driven by the needs of the family. So think about the work that you are doing right now within your system of care. And I would love to have some more examples of where families really drove some decision making, because the Federation really needs this kind of information as we do technical assistance and tell other communities it can be done. You can listen to families, make decisions, and make changes that really have an influence. So is there any other examples like that out there? I know families are helping make some really good decisions. What have they been?
Does anyone have an example of families working on budgets, system of care or system budgets?
Well, this is Libby again from North Carolina. I know when our state was going for the System of Care Expansion Planning Grant, the first thing they did was to get the family organization, which is North Carolina Families United, involved in the very beginning in the discussions, and we've been there from day one, and that included in the budgets and what we wanted the goals for the grant to be, as well as being a part of involved in the evaluation. So I think that the family voice has been very top of the line in some of that on a statewide level right now, looking at how we want to expand this across the state.
Thanks, Libby. How about hiring? Have your family organizations or lead family contacts or any family members been involved in the hiring process in any of the for any of the positions in your community? Well, that's something to think about, you know.
You know, as we kind of go down this list, and one of the reasons that we are having these conversations is we know that there's pockets where this is happening, and we've heard some of your comments from North Carolina and Kansas and other states. But what we do know that nationally, we haven't gotten there on that continuum of moving to family-driven decision-making and family-driven practices, because families are sitting on committees and sitting on boards, but we really want to be able to point to examples where that is really having an impact in things like Marie was mentioning, our families deciding on, once you get funding, are you deciding on what programs are worth funding based on what families say work and don't work? Our families really in the hiring decisions. Our families really able to evaluate and give feedback and say, this particular service is not working. Let's not do this one, but let's do this instead because this is what family wants, and those kind of things. And so we really feel like we have some work to do around implementing decision-making within the concept of family-driven care. So have any of you thought of any other things any other examples where families really are sitting at that table and influencing the decisions that are made on that governing level?
Sandra, this is Barbara. And, I've seen in more than one system of care, I've seen a family member from the family organization and a project director be co-project directors.
Yeah.
And I have seen some real partnership work where families actually did have a lot of the same decision-making power that the co-project director, who was indeed a provider, professional in the field, they really have worked out a good partnership. I've also seen it not work at all. So I've seen it both ways. And I've also seen where I think some of the most difficulty that I've seen in it, and I'm not sure everybody would agree, but I've seen where the family organization and the providers come together, the grant the grant gets written, and it's a real partnership in the writing. And then as it plays out after they get the grant and as it plays out, the two people that were, the family, from the family organization and the provider, the project director, they have this great relationship, and then suddenly staff changes happen, and it's not that way again. And it's what it says to me is the good news is it's all about relationships, and the bad news is it's all about relationships. You know what I mean? About the relationship rather than having embedded it into the real work.
Mm-hmm.
And so it's good news and the bad news, but I do think it starts with relationships, with, how people have developed them over time. And like I think Libby said, when you sit down from the very beginning and do some of the work together and then play it out together, there really is some joint decision-making then that gets made. I think that when you bring families in way later, it's much more difficult.
Yeah, I agree.
You ask them to partner after you've already made all the decisions, and then suddenly think, well, I didn't, I wasn't part of that decision making, and I don't even agree with it, and now you're asking me to partner around that, and so it makes it very difficult.
Yeah, I agree with that. I heard someone else getting ready to comment.
Oh, I think that may have been me clearing my throat.
Oh, okay, that's fine.
Sorry.
Now, I have a question, and it's kind of what Barbara said made me think about this, and Libby gave an excellent example of how North Carolina Families United was at the table when they were developing the grant proposal and making those decisions from the beginning, and that is a very good place to be. But on the phone, those of you who work with a system of care community, I have two questions, and I hope people jump in and give me, it can be quick answers. Were you involved in the writing of the grant, number one? And number two, since the grant has been awarded, have any of you had the opportunity to read the grant so that you know exactly what your state or community has agreed to do for the federal government?
Sandra, this is Libby again. I hate to keep talking so much, but yeah, that's a yes here in North Carolina, because not only were we involved, not just the executive director from our family organization, who is a family member, but I was, as well as several other family members. And yes, I got the grant. I got a copy of the grant before it ever went to the feds, so I did see it. And yes, I, as the lead family partner, as well as several others within our organization, are all on these state-level committees that are overseeing the expansion planning grant. So yes, we are involved in it all the way through so far.
Wonderful. How about the rest of you guys who are working specifically on a grant? Were you involved in writing it, and have you read the grant? And people can just say yes or no.
My director was involved in in the process with our system of care, and has a good relationship with that person.
What about others? Have you read it? Did you help write it?
I don't believe we have a current one in Idaho, System of Care grant.
Right. Well, one of my hats that I used to wear, Maria and I have both had years of experience, and Barbara as well, is doing technical assistance and doing a lot of site visits. And one of the things that I did every time I did a site visit, whether it was just a community visit or with the federal government on a monitoring site visit, I would ask the family members in the room, have you read the grant? Has anyone given you a copy of the grant? And they would, 90% of the time say no. So I didn't say, well, how can you sit on the governance board and help make decisions when you really don't know what it is they promised the government they would do? And so, we would then ask if they could have a copy of it and then have somebody to support them in kind of deciphering through, because sometimes that's such technical language. So I think that, one of the things that you guys on the phone, if any of you are on the phone and you're working within the system of care expansion or planning or implementation community grant, and you have not had that grant in your hand and able to read it to see exactly what you guys are supposed to be doing, I would start by asking if I could see that and have a copy. And I would also support the families who work on the other committees in reading through those, because a lot of times, and it helps in both ways. It not only helps to understand what is supposed to be happening so that you can see if something's not happening, but it also answers the questions on sometimes families want things that they can't have because it's not covered in the grant, and they have to find other ways of doing it. So it really helps communication. It really helps manage expectations. But I'm always surprised when we get to this part of any of our discussions or webinars, when we ask families, have you read the grant? Do you know what's in it? And very few can say that they have. So to us, that's a critical component of being involved in decision making. You can't, if you don't know where you're going, you have a little chance of getting there.
Yeah, and just so that you know, this was something that we always worked on in the past with the family leaders, is that it's not a secret what's in the grant. It's a government grant, so it's something that that should be open knowledge for anyone who asks. It's not something that is a secret. It's something that's like public knowledge.
Right.
So
But
ask
this
for it
is
if you have
Thomas,
it.
if I could comment to that, a lot of the families of diversity need that permission in order to access information like that, just
Right.
because of historical interaction and, in working with the government.
Yes.
It's just a cultural difference. And if families aren't told that they can do that, they're not going to do it.
Right.
We totally agree with that.
Now you heard it.
And, and I think that one of the, things that we can do as TA providers is to talk to the providers, the people who hold that, and then say, why don't you just offer it, make it available so that families don't have to ask. I think that I would love to see us get to the point where we don't have to go in and say, I would really like to have a copy of that. But I think whenever they, any community form their governance, advisory boards, community collaborative, they should make that available to everyone on the team. So, and then that will kind of, you won't have to be in that uncomfortable place of saying, I want to have that document. So, but thank you guys.
I think we're coming to the end of our hour, and it's really been a wonderful discussion, lots of good ideas. Certainly, if you have questions about anything that was discussed today, you can email us, and we can get you in touch with others on the line who might have some answers for some of your questions. And on August 7th, the topic is going to be evidence of family involvement in program planning, implementation, and evaluation. So kind of on the same topic, but we're talking about taking family-driven to scale, and so this is all part of it. So we hope that you'll join us then, and also we like you to save the date and also to start registering for our annual conference. Again, the system of care grantees are really required to send people to conferences every year, and so there's money for it there, so please start asking if you haven't already. And come on to our 25th annual conference. It's going to be really super.
So we really want to thank everybody for participating. It was a rich discussion. It was recorded, so we will be able to send it out to folks who are on the call and those who weren't able to make it so that they can listen to it, along with the slides that have the questions on it. And if you have any additional questions or follow-up, we'd ask you to send it to Maria and I. And if you have really good documents that we can share with policies and procedures, or things that you have that helps families in decision-making and that you would be willing to share, we ask that you send those too. So thank you for joining us, and we hope everybody has a really good afternoon. Thanks, everybody.